Hello everyone, nice to see you again. I hope you are doing well at such difficult times. In our last 4 episodes, we discussed how the most important time window to fight the COVID-19 or the CCP virus was lost due to the Chinese Communist Party, the CCP's suppression of information and negligence, and things deteriorating rapidly after the CCP admitted that the virus spreads from human to human. Today, let's continue with what happened in late January and early February. On January 27th, as the publicly reported death toll surpassed 100, the State Council of China announced that the Chinese New Year holiday would be extended until February the 2nd. Also on that day, Chinese Premier Li Keqiang went to Wuhan to inspect. When he asked local officials whether they had any difficulties, the officials all shouted out loudly, "No!" As a matter of fact, as we've already shared in our last episodes, almost all the designated hospitals in Wuhan were overwhelmed with patients. Some medical workers not only did not have enough supplies, but also ran out of food for 3 days when they had to stay at the hospital day and night. However, local party officials shamelessly said to Premier Li Keqiang that they didn't have any difficulties at all. Also on this day, the mayor of Wuhan City, Zhou Xianwang, admitted in an interview with CCP's mouthpiece, China Central Television, that the local government could only disclose information about the epidemic after the central government gave a green light. He indicated that he had reported the epidemic to the central government, but the central government held the information until January 20th. Also on this day, WHO updated its advice in relation to the outbreak of the novel coronavirus and continued to say that WHO advises that measures to limit the risk of exportation or importation of the disease should be implemented without unnecessary restrictions of international traffic. WHO advises against the application of any restrictions of international traffic based on the information currently available on this event. On January 28th, Hong Kong announced significant cuts to transport services to and from mainland China. Also on this day, CCP leader Xi Jinping met with visiting WHO Director General Tedros Adhanom. Xi Jinping said that he had been personally directing and personally arranging the disease control efforts. Many Chinese netizens ridiculed his statement as they didn't see or know about any of Xi Jinping's disease control effort at all. As a result, the word personally soon became a sensitive word at some Chinese social media platforms. Also on this day, the CCP released its 3rd version of novel coronavirus pneumonia prevention and control measures and stipulated that asymptomatic patients cannot be counted as confirmed cases. The 1st to the 6th version of all stipulated that a patient could only be counted as a confirmed case after he or she showed symptoms. Also on this day, U.S. Health and Human Services Secretary Alex Azar said Beijing declined an offer to send a team to China. On February 7th, he says the U.S. had been offering for more than a month. On January 29th, Wuhan Police Bureau's official Weibo account posted an update regarding its arrest of 8 doctors who were accused of spreading rumors. The update says, in accordance with the relevant provisions of the law of the People's Republic of China on punishment for public security administration, the Public Security Bureau educated and criticized each of the above-mentioned 8 persons. Because their violations were minor, no warning, fine, or detention was imposed. Also on this day, the New England Journal of Medicine published a paper authored by a group of experts including Feng Zijian, Vice Director of China CDC, Yang Bo, Director of CDC of Hubei Province in China, and Gao Fu, Director of China CDC. According to this paper, there were clear signs that human-to-human transmission existed as early as the end of December, as 7 medical workers already got infected between January 1st to January 11th. Also on this day, the Chinese edition of the Epoch Times published an exclusive investigation report saying that according to its investigation about the numbers of funeral homes and crematorium in Wuhan, as well as how these crematorium were running at their full capacity, daily death number could be no less than 200, which was 10 times of the CCP's official number. Also on this day, a social media post about a disabled 17-year-old boy being starved to death at home after his single father, Yan Xiaowen, were taken to a quarantine center was widely circulated in China. The content was confirmed on the following day by official Chinese media. This reflected another huge problem during the outbreak in China. That was the secondary humanitarian disaster due to poor or mismanagement. Videos of people's homes being welded, sealed off, or completely blocked were circulated widely, showing that there is no basic respect, trust, or human rights in Communist China. On January 30th, the WHO finally declared the coronavirus a global health emergency, while expressing confidence in China's capacity to control the outbreak. However, the organization recommended against border closures, visa restrictions, and quarantine of healthy visitors from affected regions. Also on that day, Michael Lai, a top Taiwanese virologist, said to the Chinese version of the Epoch Times that asymptomatic virus carriers can also infect others. This made the disease control much harder, as the traditional temperature screening cannot identify the virus carriers. The Epoch Times also reported a case of a woman going back to her hometown in Henan Province from Wuhan on January the 10th to spend Chinese New Year holiday with her family. She did not have any symptoms during her 10+ days stay, but had infected 5 members of her family. Russia also announced that it would close its Far East border with China in an attempt to prevent the spread of the CCP virus. The US CDC announced that non-US citizens, lawful permanent residents, and their families who had been to China in the past 14 days could not enter the US. On January 31st, Alex Azar, Secretary of Health and Human Services of the U.S., declared that the coronavirus presents a public health emergency in the United States. Also on this day, Iran canceled all flights to and from China. However, privately owned Mahan Airlines, which has links to Iran's Islamic Revolutionary Guard Corps, continued service between Tehran and China, including Wuhan, for at least another week. On February the 1st, global CCP virus cases exceeded 10,000, surpassing the 1,100 SARS cases, Australia closed its borders to non-citizen or permanent resident travelers from China or had been to China. Also on that day, in order to explore the true situation of the epidemic, Wuhan resident Fang Bin went to several hospitals, including Tongji Hospital, Union Hospital, and Number 5 Hospital in Wuhan, and secretly shot videos inside the hospitals. One video shot from Number 5 Hospital showed that 8 bodies were moved out of the hospital in just 5 minutes. He uploaded those videos to social media accounts, and some videos immediately went viral internationally, including the one I shared with English subtitles added. At around 7 p.m. in the evening, police broke into Fang Bin's home and took him away to the police station, accusing him for having detonated a nuclear bomb. "Why didn't you shoot something looking good?" the police asked him and accused him for creating panic. He was released at midnight and had to bike for 3 hours to get home. He said that he was released because of the public attention he was gaining, but his desktop and laptop computers were confiscated by the police. In the following days, Fang Bin quarantined himself at his home and made a video every day to share his thoughts. He eventually called for a nationwide Help Ourselves movement and showed a handwritten poster saying, "All citizens resist, hand power back to the people," on February the 9th. On the following day, which is February 10th, he was arrested. And until now, we know nothing about what has happened to him after that. Also on February the 1st, Dr. Li Wenliang tested positive for coronavirus. On February the 2nd, Hubei province announced it would quarantine all people of confirmed and suspected cases, as well as who had contacts with known cases, and a makeshift Huoshenshan hospital was completed. Chinese language media Caixin published an article entitled "People Who Are Not in the Statistics, Do They Die from Ordinary Pneumonia?" The article was deleted later. According to this article, Caixin reporters interviewed 10 families. Most of them were all infected. Sometimes doctors were very sure that the patient had the virus, but because there were not enough testing kits, they couldn't be diagnosed. Because of lack of medical resources, to be able to get a bed in the hospital became a mission impossible for many people. They had to stay home and have their family infected too. Some died at home, and the cause of their deaths were counted as ordinary pneumonia, and those numbers were never included in the statistics. A video showing police in Shenzhen city demolishing a woman for posting information about coronavirus on social media was also circulated, showing how widely the crackdown on information existed in China. Also on this day, the first coronavirus death outside China was reported, a 44-year-old man in the Philippines. On February the 3rd, China's stock markets reopened. The Shanghai index plunged 7%, its biggest one-day drop in 4.5 years. A number of Chinese media outlets received reporting bans calling for restrictions on coverage of the outbreak. China Central TV reported that 1,400 military medical workers would be working at the newly completed Huoshenshan Hospital, and the first batch of patients were transferred there. Wuhan City announced that it would start to build multiple Fangcang hospitals to host minor symptom patients. On February the 5th, Chinese media Caixin reported that fever patients were found in several buildings in the Baibuting community of Wuhan, where the Grand Chinese New Year banquet attended by 40,000 families was held on January 18th. Also on this day, the Chinese embassy in Canberra criticized Australia's travel ban on entries from mainland China. On February the 6th, citizen journalist Chen Qiushi went missing after he said he would go to a Fangchang hospital. His mother posted a video calling for help. His whereabouts is unknown to this day. The last video he posted was one he shot at a Fangchang hospital on February the 4th. Also on this day, videos of poor conditions of Fangchang hospitals were leaked and circulated on the internet, showing patients complaining that they didn't see a doctor in 3 days and nobody was taking care of things there. Also on that day, the diary section of a popular Chinese social media platform Douban was shut down. Chinese netizens claimed it was because many people choose to write about the CCP virus diaries there. In the meantime, many posts seeking help at the Weibo platform were deleted. Out of more than 3,000 posts, only about 206 were left. People took to Weibo to seek help desperately when their families were dying. Also on this day, CCP leader Xi Jinping personally ordered increased censorship on the internet on all news about the virus and to close the WeChat accounts of those criticizing the authorities. On February the 7th, Dr. Li Wenliang, the whistleblower of the CCP virus, died of it himself at the age of 34. His death caused huge public attention and anger. Many people expressed their condolence on social media. The hashtag "We Want Freedom of Speech" trends on Weibo. The same day, along with other related topics, it was deleted. On February the 8th, apart from the covered-up numbers, more than 36,000 people have contracted the CCP virus, and the death toll exceeded 800, which means the CCP virus had killed more people than SARS. From the above discussion, we can see when more and more people were dying, suppressing the true information has always been a priority of the CCP. It was extremely hard for the outside world to get a real number and a real picture of what was going on. People who risked their lives to try to get some true information out soon disappeared. For most parts of the world, people were still believing in CCP's numbers and making decisions based on what the CCP told them. And that's why the virus was able to attack more than 180 countries and killed hundreds of thousands later. That's all for today. Thank you for watching. We'll continue with our timeline next time. Now we can see that truth does save lives. Please subscribe to my channel and help to spread it. Thank you again. See you next time.